So I'm recording. So the bulk of this conversation is going to be going through 20 muscles. I'll describe them. I'll draw pictures. I'll write their names and we'll list their origins, insertion, and actions. Before I do that, just to remind you, origins and insertions are just points of attachment to bones. The origin point or points being the attachment where there is no movement during contraction. The insertion end usually is where there is movement during contraction, and the action just describes the type of angular movement that muscle contraction produces usually at a joint. So let me call up my first whiteboard. And I'm just going to list these. And if you want to write, if you're recording this, great. If you want to write them down, that's fine. But just so you know, I am going to post this list as well. So don't feel like you have to write down. Let me get my black pencil just because it's easier to see. So I'll number them 1 through 20. Now, number 1, I'm just going to write this word, frontalis. That's sort of the street name, the easy distilled Reader Digest version name of this muscle. Technically, it's got different books use different names for this muscle. This is the forehead muscle. And scientifically, it's called the frontal belly of the epicranium or epicranius. So it's a lot easier just to say frontalis. So I'm going to just quickly give you the location, forehead, and it originates. So I'm going to write origin. After I write origin, insertion, and action for the first one, I'm just going to write O, I, and A for the rest of them for abbreviation. The origin of this muscle is called the cranial aponeurosis. On top of our head, on the top of our skulls, is a flat sheet-like tendon. You know that now. That's what an aponeurosis is a flat sheet-like tendon that secures this muscle to the bone, almost back by the crown of our head. The insertion end, remember, these are just points of attachment. The insertion is the skin. I'm just going to write skin at the eyebrows. So if you were to trace a line across your eyebrows, including the bridge of your nose, it's called the root of the nose, that's where the insertion attachment end is. And the action just means what happens when this muscle contracts. Mostly, it raises the eyebrows. It also wrinkles the forehead. So this is just telling us what that contraction produces. Okay. This one's not, it's got so many different names that I'm not going to put the context of the 7 criteria with this. Technically, if we call this the frontal belly of the epicranium, it's telling us, the names are telling us the location of this muscle. So remember, that was one of the 7 criteria. Number 2 on our list, and remember on quiz day, I want you to focus on these muscles that I'm writing down on this list. Orbicularis oculi. Orbicularis means circle or circular muscle. Oculi means the eyes or eye sockets. So that is a circular muscle that surrounds the eye socket. So that's its location, and that's how it's named as well. Orbicularis, that would be a shape description, and oculi would be a location description. And I might ask you that, just so you know, I might ask you that on quiz day. I might say, what 2 criteria, I'm just using this as an example, what 2 naming criteria does the orbicularis oculi use? And it would be shape and location. The origins Just so you know, for circular, so I'm going to draw a cartoon eye here. There's the eyeball. This muscle is a circular muscle that does this around the eye. And on all circular muscles that I'm aware of anyway, on all circular muscles, the origin is around the outside of the circle. The insertion is around the inside of the circle. So if you remember that, it'll help you remember where the origins and insertions are. So around the outside of this circle is on the top is the frontal bone, the forehead bone, and around the bottom of the circle is the maxilla. So the origins are, I'm just going to write frontal, comma, maxilla. And the insertions, like I said, are around the inside of the circle. And there's more technical terms for this. I'm just going to say skin of eyelids. That's an easy way to say that. So that's around the inside of the circle here. I'm trying to darken it a little bit. That's where the insertion points are. And the action, remember, the movement is always at the insertion end of attachment or point of attachments. So the actions are mostly it closes the eye. I'm going to say closes / controls eyelids. All right, let's move on to number 3. We're going to pretty much go head to toe here from the superior end of the body to the inferior. Number 3 is the orbicularis oris, O-R-I-S. That means circle or circular muscle. Oris means mouth, oral cavity. So it's also, this muscle is also named for its shape and location. So this is the circular muscle around the mouth. So I'm going to draw a set of lips here. And this muscle does the same thing around the eyes. It's a different muscle, of course, but it's the same shape around the mouth. Origins, remember we just said the origins are around the outside of the circle. So that would be the maxilla here and the mandible down here. So the origins are the maxilla and mandible. That's why we do the skeletal system first, by the way. And we learn angular movements first as well in the joints chapter. Insertions. I'm just going to write insertion. Technically, mostly it's the skin at the angles of the mouth. I'm just going to say skin around mouth. Actions. When this muscle contracts, it does a lot of things. Mostly it controls the lips. I'm simplifying this for you so it's easier for you to remember this and keep track of it. So when we speak, when we pucker our lips, when we make those, if you were to smile, there are other muscles involved with smiling, but the orbicularis oris is one of the main ones. All right, I'm going to go to new whiteboard for number 4. Number 4 on the list is the masseter muscle, M-A-S-S-E-T-E-R. The masseter muscle's location is down the angle of what you and I call our jaw. So if you were to put your finger or fingers right about at the middle of the tip of your ear, and then trace down your mandible to that ramus down the angle of your jaw, or if you clench your teeth in the back, like clench your molars, you'll feel that masseter muscle bulge out. That's where it's located. Its origins are the maxilla and zygomatic arch. And the insertion is the mandible. And the action, when this muscle contracts, it elevates the mandible. That's more scientific sounding than closes the mouth. Number 5 on our list is a long name, but its name tells us exactly what it is. So it's a mouthful. It's called the sternocleidomastoid muscle. But that long name is all about location. Remember, one of our criteria is location of origins and insertions. The sternum and clavicle are the locations of the origins, and the mastoid process on the temporal bone is the location of the insertion. So origins, sternum, clavicle. This is a thick banded muscle that runs up the left and right side of our necks. Insertion is the mastoid process. You don't have to, that's what I want you to know on test type. Remember the mastoid process, just so you know, is part of the temporal bone. So this muscle, if I were to look upwards, so I'm going to try to draw somebody's head. There's their nose, here's their eyes. Somebody's looking up toward the ceiling. Here's their mouth. And then here's their neck. The sternocleidomastoid muscle runs from the sternum and clavicle sort of medially here. And it's a big banded muscle that runs up just behind our ears and inserts on that mastoid process. So kind of looks like this. And its actions are many. I'm just going to list a couple. Actions, when you move your head in so many different directions, let's just say flex, extend, and rotates the head. When you move your head around, particularly in a rotation motion, or when you tilt your head from side to side, there are other muscles involved in those actions, but the sternocleidomastoids are some of the main ones involved with those actions. Next muscle is the deltoid. This one is on the shoulder. It's a big triangular muscle that's located on the top of the shoulder. And without taking up too much time here to do this, I'm going to draw a shoulder. There's the upper arm. There's the chest, the abdomen. Here's the crux of the elbow, the antecubital region right here. The deltoid muscle from the front, I've drawn an anterior view, looks something like this. There's part of that triangle, and then it overlaps over the back to complete. If I were to peel this muscle off, it would look something like this. And it lays on top of our shoulder. The origins, oops, sorry about that. Let me go back to the page. The origins are up here. The insertion is down here. So origins are the clavicle in the front on the anterior side, clavicle and scapula, shoulder blade. Insertions, actually it's one main insertion. It's the deltoid tuberosity on the diaphysis of the humerus. Right, deltoid tuberosity on humerus, just to remind you where that is. So the insertion end is here, right here on the humerus. That's going to be the end of movement. So the action is abduction, AB. When we raise our arms, that's an abducting move. Abduction of humerus. So I'm going to pause here for a minute and just give you some quick examples of types of questions to expect on the next quiz. If you encounter a question, I might just say something like, which of the following muscles is a main abductor of the humerus? Bang, right here. Or I might say, which of the following muscles, its main insertion point is the mastoid process? That's this one. So these are the types of questions. Which of the following muscles below elevates the mandible? And you would know, there you go. All right, so we're almost we are to number 7, which is the biceps brachii. Easy muscle to use as an example because we can all look at it, see it, and touch it. This muscle, it gets its name, and I might use that for a question too. I might say, which of the following muscles is named for number of origins and location? That's this one. Biceps means 2 origins, bi. Brachii means upper arm. That's why we learned this language at the first week of the course. We all know where the biceps is located, the anterior side of the upper arm. So origins, the name says there are 2 origins. And though there are 2 points, places, whatever you want to say, on the scapula. That's where it originates. A lot of people don't know that. They think the biceps brachii, and it's intuitively, you would think it originates somewhere like the head of the humerus. Technically, there's 2 points around almost the back of the scapula. The insertion, the main insertion point of this is the radial tuberosity. Sorry, my table just moved on me there. That is that bump below the head of the radius. So the radius is in the forearm. The head of the radius is in the crux of the elbow like this. There's a bulge like this underneath the head of that radius. That's where the biceps brachii inserts, right here on that bulge, that bump, that tuberosity. Actions. Its main one is flexes or flexion, whichever you want to call it. Flexes, rotates. It's also involved in supination. I'm trying to keep this as simple as possible. Let's say supinates instead of rotates. Flexes and supinates forearm. Let's leave it at that. Remember, supinates means to turn the palms upward. Next muscle on the list is triceps brachii. Talked about antagonistic muscles at our last meeting. The triceps brachii would be the antagonist to the biceps brachii, which would be the prime mover of the upper arm. So triceps brachii is located on what you and I call the back of the upper arm, the posterior side. The origins, by the way, this one's also named for number of origins and location. So it has 3 origins. Tri means 3. And those origins are 2 points on the humerus and 1 point on the scapula. The insertion is what you and I call the elbow, but we need to be scientific here. So the insertion is really the olecranon. I'm going to put in parentheses of the elbow. That outer point, if you just wrap your finger from your upper arm around the point of your elbow, you're tracing the insertion point of the triceps brachii. the action, the action opposes the biceps brachii, so it extends the forearm. And we're getting close to halfway finished. The pectoralis major. The pectoral region tells us a location. That's the upper chest. Major means it's a big muscle, and it is one of the largest muscles in the human body. So it's that broad sheet of muscle that goes over the right and left sides of the upper chest. I'll draw a picture. Sorry, that's supposed to just be an N. Origins. So really quickly, if here are the shoulders, there's the neck of a person, here's the chest, the abdomen. Pectoralis major muscle originates along here, clavicle and sternum, mostly. That's the origin. On both sides, by the way, there's two pectoralis major muscles. And then the fibers run like this. They all run to a point that looks like it's going into the armpit. And that's so the origins, let me write those down really quickly before I forget. Clavicle, scapula. Technically, there's another point of origin, but I'm trying to make it easy for you. These are by far the two main ones. The insertion. The insertion is the greater tubercle of the humerus. That's a bump just below the head or on the anterior side of the head of the humerus. Greater tubercle. I'm going to put dash humerus. Action. I'm going to list its main one. It does all sorts of things. So if the insertion point is here on this bone, the humerus bone, that's where movement's going to be. So it's going to do something to the humerus. Mostly, it acts as an adductor, ADD. Adduction, that means to move toward the midline of humerus. All right. Let's go down into the abdomen. And our next muscle is the rectus abdominis. This muscle is named, rectus means that the fibers run parallel to the midline of the body, what you and I would say vertically or up and down. Abdominis is telling its location. So this muscle is named for its direction of fibers and its location in the human body. These are your abs. So we all pretty much know where those are. There's shoulders, chest, arms, abdomen, hips, and legs. There's a set, they look like they're in sets of 4 like this. 1, 2, 3, 4. That's where our abs are located. They originate, the origin is down here on the pubis. And then the insertions are going to be up along here. So origin is the pubis. I'm not going to list all of the insertions. We'll try to make it as simplified as possible. It's technically cartilage of ribs 5 through 7 and the xiphoid process. That's simplified. So I'm going to write cartilage, ribs 5 through 7, and that point on the end of the sternum right here. That's the xiphoid process. Oops, OID. XIPHOID. And the action, its main actions are to Flex vertebral column and compress the abdomen. After rectus abdominis on our list, we're going to flip to the back side, the posterior side of the human body. The trapezius. Probably you've heard of this muscle. You may not know exactly where it is or what it's shaped like. So let me do a quick diagram. If this is the back of somebody, not the front, I know it looks like the front, but here are the cervical vertebrae, gluteus maximus muscle on the back. The trapezius muscle is a diamond-shaped muscle that looks something like this. It's a large sheet of muscle that runs on the upper side of the back. The origins are located along the midline of this diamond shape. So the origins start up here at the occipital bone of the skull and run all the way down the cervical vertebrae and most of the thoracic vertebrae. So I'm going to write O for origins to save space. I'm going to write occipital. That refers to the occipital bone, the back of the skull. And now I'm just going to write cervical and thoracic vertebrae. So all the way down this center line is the origin. Then the fibers do this. They all run out this way to sort of the shoulder, what you and I would call the shoulder region. And the insertions, I'm just going to list two. It's the clavicle in front, but mostly it's the scapula in the back. So I'm going to list that one first. Most of the fibers insert into the scapula. A few of them, a little small portion are the clavicles. Scapula, clavicle. Action, what does this thing do? It basically controls almost all movement of the scapula. And that's describing a lot of things. So I'm just going to list two. Elevates, comma, rotates scapula. When you shrug your shoulders, when you lift your shoulders up, your scapula is sliding along the back of your, practically on the back of your ribs. That's your trapezius muscle in action. I don't think I can squeeze the next one on here, the latissimus dorsi. Well, maybe I can, and I'll use the same picture. The latissimus dorsi muscle is next. Where is that located? I'll tell you that first. Dorsi means dorsal surface of the back. So we're on the back side. There's a large sheet of muscle that originates sort of down here in this area. And it's a huge sheet of muscle. It's one of the largest sheets. And it goes up to the armpit. So the fibers run like from down here all the way up. It's the lower back. Your lower back is largely covered with this huge sheet of muscle called the latissimus dorsi. Let me go back to my black pencil and list. I'm not going to list all of the origins for you, just a couple so that it's a little bit easier. The origins are basically both the thoracic, some of the thoracic and lumbar vertebrae, as well as the iliac crest and sacrum. So let's just say lumbar, comma, iliac crest, comma, sacrum. Insertion is the humerus. It's going to control the arm, some arm movement, which is surprising to a lot of people. The action is that it also adducts the humerus, similar to the pectoralis major. Let me write the action over here of this muscle so you don't get confused. Action is, my table keeps moving on me, adducts humerus. Technically, the word adduction means moving toward the midline of the body. What this muscle does, you use it a lot. If you do pull-ups, I know most of us don't, including myself, but if you were to hang from a bar and pull yourself up like doing a chin-up or a pull-up, that is using this muscle, as well as bending over. You're putting on a pair of pants and you bend over and you pull up your pants to your waist. You're using your latissimus dorsi, or you bend over and you pick up like a suitcase, a heavy suitcase, or you pull the starter, the hand starter crank on a lawnmower. Those are all typical latissimus dorsi movement. All right, we're getting close to the end. Gluteus maximus is the next on the list. That is volumetrically, I believe, the largest muscle in the human body. It's certainly the most powerful. The latissimus dorsi looks like it's bigger and the pectoralis major looks like it's larger, but they're flatter muscles. They don't have as much volume and they're not as thick. Gluteus maximus is the buttocks muscle. Most of us know where that's located. The origins, this is a super important muscle because we live on two legs. We're bipedal animals, mammals. No other mammal lives their lives completely on two legs and walks on 2 feet all the time like us. So it's incredibly, the reason that it's enlarged in humans as opposed to other mammals is because of the fact that we stand on 2 legs, walk on 2 legs, and pretty much exist on 2 legs and 2 feet. We need that power to do that. The origins are ilium. I'm just going to write ilium. It's the backside of that iliac crest. Ilium, sacrum, and coccyx, which is the tailbone. So if I draw you a picture of somebody's backside here, the gluteus maximus muscle, it originates here, the backside of the iliac crest. You know that sacrum is that triangular shaped bone here, and then the coccyx is the tailbone. The origin for the gluteus maximus is all along that line like this, ilium, sacrum, coccyx. And then it sort of wraps across the buttocks region like this, and it inserts on the lateral side of the femur. I'm just going to write femur for insertion. Sort of the midline lateral side of the femurs, but let's just write femur. This controls all sorts of upper leg movement and leg movement in general. So I'll try to shorten this one for you. Let's just say actions. Believe me, there are more than this. Extends. Let's just do 2. Extends, comma, rotates the thigh. Think upper leg or femur. That's where the insertion is. Next is, let's go to the front side of the upper leg. Next is the rectus femoris. Rectus means fibers running along the midline. Femoris means femur, so that's telling us direction of fibers and location. Origin, or origins really, of this muscle are the iliac. Let's just do one of them. The iliac spine is the big one. Let me erase that arrow. The iliac spine, if you're looking at the front side of somebody's hips, the iliac crest runs like this toward the front. The iliac spine is this point. You can feel it if you palpate your pelvis right in front on either side. That bump, that bone that you feel right there is the iliac spine. Insertions. Now this muscle does, I'm going to draw somebody's upper legs here. So there's 2 upper legs. This would be the knee region, lower leg. The rectus femoris runs right down the center. From this point, it runs down the center of the anterior side of the thigh, femur. And the origin, the insertion is down here in the patellar ligament. So it runs right over the patella, the kneecap. I'll draw that. So this patellar ligament, and then it also, so it inserts there. It also inserts right here on the top of the tibia, the tibial tuberosity. So insertions, I'm going to write patellar ligament. That's the ligament that the kneecap resides in, and the tibial tuberosity. That's that big bump right below your knee that you can feel on the front of your tibia. Actions are more than this. I'm going to try to abbreviate this for you as much as possible. Let's just say it extends. This is the main one. Extends lower leg. I assume you're all sitting in chairs. I am. If you were to raise your lower leg and stick it out as you're seated, that's largely this muscle, all of your quadriceps, and the rectus femoris is one of those quadriceps. So it extends the lower leg. It also flexes the thigh. So I'm just going to say extends lower leg to keep it as simple as possible. We're going to go to the back side now again. So I kept my gluteus maximus picture here for a reason. The next muscle is the biceps femoris. 2 origins in the femur region location. The origins, there's going to be 2. That's what the name says, biceps. So I'm going to use this diagram up top here to sort of draw pictures of the biceps femoris. The origins, excuse me, are on the ischial tuberosity. That's what you and I are sitting on right now, that lower part of the ischium. So the back of the pelvis does something like this. There's a lower bone here with that big obturator foramen in it. We sit on our ischial tuberosity when we sit down right here. That's also where the biceps femoris originates. So I'm going to draw my picture. And biceps means 2. So there's 2 main bellies and points of origin of this muscle. These are considered part of the hamstring muscles, but I'm trying to draw sort of a dual looking muscle like this on the back side. The insertions are the fibula and the tibia. So let me write that. It doesn't matter what order you write these in. Tibia, fibula, and I'll try to draw those. So the lateral side of this leg, the outside is here. And the lateral side on the right side would be over here, but we're doing the left. So one of the insertions is on the fibula side, the lateral side right here. And the other is more centered on the back of the tibia. Remember, that's where movement occurs. When this muscle contracts, we don't get movement up here at the origin end. We get movement down here at the insertion end. So when you bend your knee, if you were standing up straight and you just bent your knee so that your heel went up to touch your gluteus maximus muscle, that is the biceps femoris contracting. That's its action. So let's just say flexes knee for action. It also extends the thigh, but flexes knee is the main. It's easier to remember, and it's the main action. So I'll leave it there. sartorius muscle, back to the front. There's the pelvis, the hips. We're still in the leg. I need to draw a new picture because, so this is the front side. There's the knee. The sartorius muscle does this. It looks like this big, thick, but relatively thin to other muscles, this thin band of muscle that starts on the lateral side and crosses over the front of the thigh and inserts on the medial side. So I'm drawing the sartorius muscle on this person's right side. There's also one on the other side, so let's just do both. So that's where it's located. Its points of origin, its main one is that iliac spine, just like the rectus femoris, that bump that sticks out right in front of your pelvis up here. Let me go back. So origin. Insertion, so I'm going to follow this down. Insertion is down here on the medial condyle of the tibia. This is really simplifying that chapter 11 for you, which you'll be glad come test day. This muscle does several things. It's mostly an abductor. So I'm going to write abducts. It also rotates the thigh, that upper leg. The gracilis, it's a new muscle, so I'll underline it. Gracilis, that is the groin muscle. So on the inside of the inside seam, where the inside seam of your jeans are, or pair of pants, the gracilis is also, it looks like a band of muscle that runs from up here down on the inside of our legs. I'll color this in and draw an arrow to it. There's the gracilis. This is the sartorius. The origin is the pubis. So the lower end of that pubic bone, inferior end of the pubis. The insertion is the same place as the sartorius, medial condyle tibia. You can see from my drawing, they insert at the same point. Action's a little bit different than the sartorius. This one adducts, ADD, that it brings your legs close together to the midline. So ADD adducts the thigh. We only have 1, 2, 3 more muscles. I say gastrocnemius because that's the way I was taught to say it, but there is a C here. Gastrocnemius. This is our calf, the backside of the lower leg, what you and I call the calf. So I'm going to go to the backside. If here's the lower leg, there's the heel of the foot. I'm running out of space on my whiteboard. And I'll do one on this side. So we're looking at the posterior side of somebody's. The gastrocnemius has 2 bellies, even though it's one muscle. It originates up here in what you and I would call the posterior side of the knee. Really where it's originating is the condyles of the femur. So the femur bone at the knee, it comes down and it makes these 2 big condyles like this. That's where the origination point is of this gastrocnemius muscle. It makes up the bulk of our calf, like this. And there's two bellies to it, so there's actually a division in the middle, and it looks like two separate muscles. So origin, I'm going to write femoral, that means femur. Femoral condyles. There's two big bumps on the distal end of the femur. The insertion is the calcaneus, the heel bone. I'm going to write via the Achilles tendon. This long tendon right here is what attaches it to the calcaneus. Action. Think of pointing your toes. It's called plantar flexion. When we stand on our toes, the movement is plantar flexion. Or if you're just seated and you point your toes, you stick your leg up and you point your toes to a sharp point, you can feel your calf muscles contract. Two more and we're done for the day. I'm going to do the soleus on this same page just because I need the exact same picture. So let me write soleus. That, if we were to strip this muscle that we just talked about, the gastrocnemius, if we were to dissect it, cut it off somebody and strip it away, we would see the soleus underneath. There's a C there. Let me correct that spelling so that you spell it right. You can see just a little bit of the soleus sticking out, even when the gastrocnemius is there. I'm going to use blue just to, not to confuse you, but on the lateral side of the back of somebody's lower leg, you can see a tiny bit of the soleus sticking out. If we were to completely remove the gastrocnemius, the soleus is actually bigger than that, wider than that. It's a muscle underneath the gastrocnemius like this. So the origins for the soleus are really, it's not all the way up on the femur, it's the top of the tibia and fibula, the proximal end. So the origins for the soleus are different than the gastrocnemius, but the insertion is exactly the same. It's the calcaneus. And the action is exactly the same. It contributes to plantar flexion as well. Last muscle of the day, and then we're finished, is the tibialis anterior. We know where the tibia is. So we're gonna, anterior means the front. So both of these names refer to its location. Tibialis means it's near or on the tibia. Anterior means the front side. So really quick, here's somebody's knee joint. We're looking at the front side, so I'm going to try to draw the foot as it comes forward. There's the big toe. Tibialis anterior origins are going to be at the proximal end. It's the lateral condyle of the tibia. Let me write that and then I'll draw it. So the origin for this muscle is going to be up here. Remember, this is somebody's right side, so there's the lateral side. It's the largest muscle on this anterior side of the lower leg, and it comes across. So it originates up here. It sits, bulges right about here, and then its insertion wraps around to the inside of the foot, the medial side like this. So the origin is the lateral condyle of the tibia. The insertion is the first metatarsal. Remember, the metatarsal is the first set of long bones after our ankle bones, the tarsals. So if I were to draw the long bones in the foot like this, the first metatarsal goes down. It's the long bone in the solid portion of our foot that goes toward the big toe. And the action is technically the opposite of the gastrocnemius and soleus. So these are antagonistic muscles. The action is dorsiflexion instead of, sorry, getting ahead of myself, instead of plantar flexion. The action is dorsiflexion. That's when you raise your toes, opposite of pointing your toes. If you raise your toes really hard, your tibialis anterior muscle bulges out from contraction. You can put your hand on the front of your shin and raise your toes as hard as you can. You can feel that muscle flex. I'm going to cut my recording here, so let me do that. So